I'm very happy to work with County Executives of America. One of the great initiatives is our Opioid Abuse Task Force. And our leader is your own Dan McCoy. I will tell you, unparalleled, the greatest county executive I've worked with in the United States. Seriously. He loves his county. He loves his constituents, all the people here. I look at him as a bright future for politics. He's a guy that gets things done. And what he did as the leading county in the United States, the leading county, Albany County, New York, has taken the lead with the Opioid Abuse Task Force. Dan is now co-chair. He's president of County Executives. It's my great pleasure to introduce to you someone that you know very well and I consider a very good friend, and as I said, a great leader in this initiative, the fight against opioid abuse, Dan McCoy.
We're now holding the distributors equally accountable for public health crises that change the way we're doing business with this new litigation that we're holding up in federal court. So basically, the distributors that deliver these pills, these fentanyls, and everything else around this country knew what they were transporting, and they became not just millionaires. Some of the trunking companies became billionaires. So we're holding them equally responsible. We're going to talk about that litigation, but most importantly, you know, how many people when you go to CVS or Walgreens, what's the first thing they do? They have you sign for everything at the end, correct? And they say, hey, do you have any questions or concerns? Am I the only one? Raise your hand if I'm the, come on, right? We all have to sign that piece of paper. But they have a responsibility. I go to a little mom and pop's pharmacy, Crestwood Pharmacy on Wayne Hall Road. My pharmacist always questions the pills I'm on. He's called my doctor on my behalf saying, why am I still on this? And the problem I have with CVS and Walgreens, and you look at CVS, and I commend them, I think 2 years ago, they got rid of cigarettes through all their pharmacies. It was like a $2 billion decision they made. And they're like, what corporation can get rid of $2 billion and not go out of business? They're the ones that are there at the counter knowing that if you're getting all these prescriptions, what are you doing with them? Because some people are getting so many pills, and you know what happens? It ends up on the black market. It ends up on the streets being sold to people that shouldn't be getting them. They see the amount of stuff being pushed over the counter. They have an obligation under New York State law to put up a red flag, to say something, and they have not. So they're equally as responsible as the distributors that are pushing this throughout this country. Which is alarming to me if you look at this. And we don't talk about it, right? Over a 23-year span, there has been a new record number of overdose deaths in the U.S., reaching a high of 70,000 people in 2017. 70,000. That's like taking the town of Bethlehem and Guilderland, wiping them out, waking up in the morning, wondering where all them residents went. Think of it on that. Think about just here in this county alone, take out 2 towns, and that's the amount of people that are dying. And you look at the Narcan training and everything that we set up, and we're out there constantly bringing awareness. You think how many reversals you have. You think about how many more deaths you would have if we weren't out there doing what we're doing, training people, bringing awareness, getting the stuff that they need. It reminds me of one of the last EMS calls I had in the fire department before I took this job on, and in 2011. And what really stands out is that he was on a phone, you know, the phone booths when we used to have that for you younger people. You know, there used to be phones around the city. And he literally was holding on and called 911 because he knew he had a bad dose of heroin. He knew himself. And that was in 2011. It stays with me as I think about this. How many more stories do we have to hear? How many more families got to go through this heartache? How many more people have to die? And not just, they don't have to just die. If you look at the staggering numbers and statistics of family members that are addicted to this doesn't discriminate. This affects everybody. You know, you think about your mother, your sisters, your brothers, your friends that are just popping pill after pill. They're like, oh, yeah, I don't drink. I'm not an addict. Really? Because you're taking more pills than would kill an elephant right now. It's sad, and it's scary. We've become self-medicated, and we don't, you know, I always say this. I go to my doctor once a year. You go for your checkup. Everyone go for a checkup once a year? And then don't you love it when the doctor, the nurse practitioner goes, "Are you still on this?" Well, you gave me this like 2 years ago. Did you say stop? So I just figured every month I have to, get the prescription and keep taking the medication. You have to become your own advocate. And that's why we've done a lot of awareness and training to train kids and parents, like even through our AAU program, that, when you get hurt, you don't necessarily have to take pain medicine. Or what point do you sit there and say, okay, hey, look, you've been on pain medicine for 10 days. And that's some of the things that through this litigation that we're trying to accomplish. Changing the outcome of how, first and foremost, that you don't get 30 days, that you get 4 days of pain medicine. And then you got to go back, and guess what? Then the doctor should say, all right, maybe I send you to a pain manager. Because, you're not just going to keep upping the dose. And that's what continues to happen. Here in Albany County, 33 overdose deaths from synthetic opiates, including fentanyl, up 16 deaths from 2016. 39 opiate overdoses in all, up from 28 in 2016, some of the highest in the state. Each year, these deaths represent a heartbreaking story to the families and loved ones, which, as a parent, as the county executive, that's the last thing we want to do. And as all the services we provide in the county, we don't want to have to hold people's hand and give them that heartbreak because we shouldn't be in this situation. But if and when justice is served and Albany County recovers damages, it will allow us to continue investing in programs that have been effective, like our Project Orange, our opiate task force, our Narcan training, our mobile crisis team, which we're starting 24/7. So we can go when someone overdoses and sit there and not just work with that person, work with the families and let them know the resources that are available in this county. But most importantly, they have somebody to talk to. Because obviously we're not getting this message out. We're trying to do peer-to-peer training, counseling, working with statistics, working with youth, trying to keep them away from all this stuff. And we can only do it with everyone in this audience. But I'm going to let the experts talk because I have to tell you, as president of not just NISAC and of right here in New York State Association of Counties, but being the president of the County Executives of America and listening to stories, we're not unique, people. It's just not here. It's across this whole nation of ours. And in some areas, it's worse than that we're at. And in some towns, they have 6 pharmaceutical companies, right, sitting there, drugstores on their corners with a population of 20,000 people. Didn't anyone just say, hey, how the hell this happened? But we didn't. We ignored it. We ignored it all. And it's going to take time because one of the things when we did the foster care task force, the New York Times did a great story about a year ago. And in the Times story, it basically said that we're having a crisis not just with the opiates, but with people losing their kids and putting them in foster care. And kids that are born as addicts. And they're going to continue, and we have to go through that, and that's going to take time. This thing's not going to heal up. We don't have the magic wand that's going to change things, but we can by educating people and by bringing the pharmaceutical companies and distribution companies and everyone accountable for what's going on and who caused this problem.
On behalf of Linda, my partner Joe Rice, and our firm, we're very proud to represent the county in this important action. This action is unique, and I'm here to talk more about the specifics of the action. What we did this morning is we filed a complaint on behalf of the county against the distributors of opioids. It's an important distinction from what's already been filed. Last January, the county filed a complaint against the manufacturers of opioids, and the basis of that complaint was the marketing, the false information, the misrepresentations of benefits and risks, and that effort to literally change the culture of how we treat pain in this country. And that force of increasing sales through this misinformation was primarily driven, although not exclusively, by the manufacturers. And that's the complaint that we filed last year. This year, and today, we file now a complaint against the distributors. The next step in the process of getting these pills into our communities is a process where the distributors take from the manufacturers these pills and then bring them to market. And the way they do that is distributors bring to market opioids by entering into arrangements, agreements with chain pharmacies and with independent and small, medium-sized pharmacies, and they do it in volume. That is, the distributors are the ones that engage in not just the delivery of these pills to market, but the relationships with the pharmacies and the doctors directly in some instances to get the pills out into the communities. Now, having the right to do that distribution comes with an obligation in law. That obligation is provided and was first created in federal law in 1971 under the Controlled Substances Act. Now, in that act, essentially what it says is that if you want the right to distribute these pills to market, you have an obligation to make sure that these pills go only for medical necessity, only for intended use, and that they are not diverted. That is, they're not somehow taken from medical need and used in an illegal or an illicit way. And the distributors are uniquely positioned by their own comments. They're uniquely positioned to police how many pills get out into market. So the complaint that we filed today is a complaint that basically says, in our society, there are way too many opiates. There are way too many pills. And these companies that we sued today are the companies that are charged by both federal law and by New York's law to make sure that there is not an oversupply. These companies that we sued today have an absolute obligation to, quote, know their customers, end quote. They need to know when they bring on a new customer, a new pharmacy or a new doctor, that their product is being used only for the intended use and that it's not going to be diverted into an illegal or an improper use or misuse. They have the obligation to make sure that these pills don't change in volume, in size, in frequency, or pattern of how they go out to these customers, that is, distributors, whenever they see in their own sales records and transactions that a pharmacy or a doctor is getting more than before, or getting them in a different pattern than before, or a different frequency than before, they are obligated not to ship that opioid to that pharmacy or that doctor until they do what's called due diligence. That is, they're required to understand why there's a change in circumstances. And if we were to put up a graph today of the sale of opiates in this country from 1996, when OxyContin was first launched, till today, it would look like a slow climb and then a mountain of pills in our society across this country. And that mountain was created by an absolute, abject failure of these companies that we sued today, policing, doing the due diligence, doing what they need to do to keep these pills off the street, and making sure that these pills are available for those who truly need it. That is, those at the end of life, or those who have cancer pain, or very specific types of pain, not the kind of pain that ultimately our culture allowed to treat. There are different statistics about how many people who end up dying of illicit drug use, the heroin or the fentanyl use, but how many of them start with opiates. But as we see, and you'll see in this complaint, if you read it, 80% of those who die from a opioid-related death at some point in their life started or had a prescription to opioids. So this is a real problem. This complaint is an important facet of an important fight. Our healthcare professionals are fighting it on the street with treatment plans, education. And now the county, as part of that fight, has decided to increase the width of its legal challenge to this national epidemic by bringing the distributors into Albany County's complaint into its fight against this epidemic, and hopefully create the beginning of the end to this absolute indifference to the amount of supply that's gotten out into the street. We are available for questions, happy to talk about the specifics of the complaint. Certainly, it's a problem that is serious in this county, but it is a nationwide problem. So in the end, when you look at the causes of action, what we are asking for is for the county to have what it did pay out for all this time in dealing with this problem as a county. But as important, if not more important, we're asking that these defendants participate in an end game where at the end of the day, we're asking through our public nuisance claim, we're asking that these defendants actually participate in fixing the problem, not just paying for what they did. And that is the real goal of this litigation. We're proud to represent the county for its motivation to take this on very proactively. There's no time to sit back and wait. The physical chemical dependence, as the health professionals will tell you, can start within days, not even weeks. And so there isn't time to waste. And so I applaud the county for its decision to not wait, not make this a situation for other people to fix, but to very actively be a part through litigation of the hopefully the mitigation, if not the resolution, of this very tragic epidemic in our country.